Hi, everyone. Welcome. This is Dr. Val, and it's another Sunday morning. And today I'll be discussing help. I have a CPAP machine. I can't use it. What do I do? So, when you take a look at how many people actually can get used to being on CPAP therapy, there's such a wide range. And I was actually looking at some of the research studies last night, and it was super interesting to me to find out that the data is pretty old. And the data that is available says that the range is anywhere between 30 to 80%. And being super biased, since I'm a medical sleep doctor, I want to say that my patients have a higher compliance rate, meaning how many people can actually use it. There are studies that say if you do see a sleep doctor, you're more likely to be able to get used to therapy and use it on a regular basis. So, with that said, this is why I'm here to help all of you folks out there, especially the ladies, try to learn what your options are when it comes to treatment for your obstructive sleep apnea. And just as a quick review, what is obstructive sleep apnea? Sometimes we shortcut it to say OSA or just sleep apnea, but this is a medical sleep condition that happens when you sleep, only when you sleep. It's a physical obstruction of the upper airway. So typically, it's the muscles of the back of the throat here, the tongue, where it falls back and closes off your airway. And this happens at least 10 seconds, 5 times an hour or greater during the sleep apnea test. We say that this is obstructive sleep apnea. The mainstay of therapy is something called the CPAP, which is called continuous positive airway pressure. And really, what it is I'm sure you've seen by the side of the road those waving arm balloons. Usually, car dealerships have them. And all it is, it's pushing forced air in. So it's an air compressor that really helps open up your airway so that when it collapses at night, you can breathe better, which is really important because if you're not getting enough air and oxygen, it's super stressful for your body, especially if you're having higher rates of sleep apnea. Typically, what we consider moderate to severe is above 15 times an hour we have difficulty breathing, because those folks have higher rates for cardiovascular disease. So things like high blood pressure, regular heartbeat, and even heart failures and strokes. So things we certainly want to prevent, because the number one killer in the US is heart disease. So with that said, what are alternative options to using the CPAP machine? And as always, it depends on a couple factors. The biggest is probably what your anatomy looks like, your body mass index, how big your neck is around, how big the size of your tongue is, how big your jaw is. There's a school of thought that thinks if we can really get people who are younger, like kids who have a small airway based on their mandible, their jaw size, how narrow or high arch their palate is, and really expand that and help open up, almost do some renovation, break down some walls and open it, they can breathe a lot better. And it makes a lot of sense, right? The more space you have to breathe, the more space your tongue has, it's less likely to fall back. So with that said, there's different orthodontic devices called maxillary expanders that may help. There's another one called a dome procedure, where I'm not actually sure what it stands for, but you can actually, some people are breaking the top suture of the roof of their mouth to help expand their airway. I would say more commonly, a lot of what some of my patients use is something called the oral appliance or the mandibular advancement device. So a lot of people who have sleep apnea can also grind their teeth. When you're not breathing well at night, your muscles are going to be tense and clenched down. So some dentists really believe that untreated sleep apnea can lead to that bruxism or clenching. So moving the tongue out of the way through different devices, or the mandibular advancement device, what it does, it's 2 trays. So typically, if you had a night guard, it's just 1 tray, so that the friction is reduced, so you can still grind your teeth, but it doesn't wear down your enamel. So it doesn't really fix the underlying cause. But if you have a mandibular advancement device, what it's doing is moving that lower jaw forward. Because when your lower jaw is forward, right, your tongue is out of the way and you can breathe better. And so that may help with some of the grinding as well. But I always want to make sure, if you do decide to get this, as always, see a trained professional, a dentist who knows what they're doing, because it can move your jaw around, it can move your teeth around. I've had patients who have basically self-treated themselves by buying something online, and now they're left with open bites and they need surgery because they can't even eat and close their mouth. Some people have needed braces afterwards. So It's not without any consequences, but for a lot of people, they find it easier to have a mouth guard instead of wearing the CPAP machine, the mask, and everything. So that's one option. Another option is honestly surgery. And what do I mean by surgery? Bariatric surgery, if you're overweight or obese, may help, especially if your sleep apnea is related to weight. Not everybody's sleep apnea is weight related. I have a lot of people since I practice in Hawaii. People of Asian descent have lower BMIs, but they have sleep apnea based on having a smaller chin and jaw and smaller airway. But yeah, there certainly have been studies, and I've had patients who've been able to lose a significant amount of weight by having bariatric surgery or through other dietary changes, and that can actually improve their sleep apnea as well. So, what are other options? So, oftentimes in kids can have sleep apnea just based on tonsil size. Removing the tonsils can help. Also, removing the adenoids can help. So that's one type of surgery. Some people who have issues with nasal septal deviation or polyps or turbinate hypertrophy, having surgery to open that may help, but at the end of the day, it may play a partial role. And some of my friends who are ear, nose, and throat surgeons say it helps more with snoring rather than obstructive sleep apnea because the tongue can still fall back and close off your airway. So it's really complex because there's multiple levels of obstruction: the back of the nose, the back of the throat, the tongue, and even the muscles more downstream that are collapsing. Another pretty interesting surgery is called the hypoglossal nerve stimulator. And what is that? Well, it's actually an implant in your chest wall with a wire that goes down near the lungs. So, what happens when you take a deep breath in? There's another wire that sends a signal to the nerve to the tongue called the hypoglossal nerve, and it makes your tongue go forward. So instead of your tongue falling back to block off the airway, the tongue is advanced forward like this and it opens up your airway. It's pretty invasive. You need to have a really good surgeon to implant them. But I've seen a handful of patients and it's really been impressive. I mean, it's not a home run for everybody, but a couple of patients, who are only sleeping 5, 6 hours, tried CPAP for many years, now are able to sleep 7 and 8 hours. And that is pretty phenomenal, to be honest, because really at the end of the day, their other options were quite limited. So I really like giving people options, and it's a matter of finding out what works best for you. Another option that hopefully, if you have obstructive sleep apnea, your doctor told you about is positional therapy. Uh, Sleep apnea is certainly worse when you're flat on your back because gravity is pulling down on the airway. I've seen, a handful of patients, maybe even a significant amount, it's hard to say. It's just almost my recall. But I've had some patients severe sleep apnea when they're flat on their back. And then, they say, I don't really snore at home. My partner says I'm okay when I'm on my side. Or, I just bought an adjustable bed and I'm sleeping with my torso raised. Those positional changes can really help. Why? Because it moves the tongue out of the way. So if have sleep apnea, typically I would say more on the mild side, but, it doesn't hurt if you can find a way to sleep on your side. There's positional belts. There's pregnancy pillows, probably a lot more comfortable. Back in the day, we would ask patients to sew tennis balls in an old t-shirt as a way for them to get off their back. And now, adjustable beds hopefully are an option depending on your price point. But sleeping more upright certainly can help. Some of my patients who don't have an adjustable bed, they just sleep in a recliner, like in their lazy boy. And when they sleep more upright, they feel so much better. You don't even have to have these fancy types of beds or recliners. Just get a couple of pillows and raise your torso. Or there's wedge pillows that can help as well. So positional therapy is really phenomenal. Another treatment option that has been around for a while, but doctors certainly don't talk about it often, is myofunctional therapy or generalized exercise. So some reports have shown that if you have obstructive sleep apnea, just generalized exercise can help. Making your muscles stronger certainly can help. That's myofunctional therapy, exercising the muscles of the tongue and the upper airway. But generalized aerobic exercise, even with some resistance training, if you're healthier overall, it makes such a big difference for your for your breathing at night too. And you also sleep better when you exercise. So that may be playing a role. So in summary, I think there's a lot of things that I talked about. I think the biggest one maybe overlooked sometimes is just positional therapy, sleeping on your side, raising your torso a bit. If you do want some kind of intervention, really, and it depends on the severity, what your anatomy looks like. So please go see a board certified, ideally fellowship trained sleep physician that can help through the American Academy of Sleep Medicine. That's a great way to find out, or just through different medical boards. So positional therapy. If you tried that and it still can't help, exercise, lifestyle factors are really important. Avoiding alcohol because alcohol makes the airway more floppy. Seeing a dentist, a specialized trained sleep dentist. They can make you an oral appliance or see if there's other expanders that can help open up your airways. Some orthodontists know about this as well. An ear, nose, and throat surgeon, they're the ones that can remove excess soft tissue. See if you're a candidate for the Inspire, which is that hypoglossal nerve stimulator. Speech language pathologist do the myofunctional therapy. I know a dental hygienist that does it as well. There's some videos on YouTube that you can check out. And let's see. I think that's it. I think that's the quickest rundown. And I guess maybe, this is alternative therapies to CPAP, but the question always is, why did you have a hard time with it? CPAP still is the gold standard. It really, really works. I'm trained in clinical hypnotherapy. Sometimes some of my patients who have a hard time sleeping with the mask on, it's because they're claustrophobic. So finding the smallest mask possible, helping them relax, and it's really teaching them the reason behind that can be really helpful. And I think that's why adherence rates to CPAP are higher. Adherence rates to CPAP are a lot higher in sleep physicians. Another thing to consider is changing the pressure, right? Sometimes it can be an issue with the pressure being too strong. So finding really ways to work with your healthcare provider, your sleep specialist, if you do have a hard time with your CPAP, and finding what works best for you. So I hope you found this video helpful. If you have any questions or comments, go ahead and put it below. And yeah, happy to see you on a next Sleephoria webinar. Have a great day and rest well, everybody.